Hi, I'm Dr. Stephen Stokes, and I'm here to give you some instructions on your DDS 500 spinal decompression brace. Before we begin, I'd like you to realize that 90% of all back pain has to do with the cushion between the bones of your back. This is called the spinal disc. Now, these discs act like shock absorbers between the bones, and they allow for normal motion, but they also provide a spacer to protect the nerve root that comes out behind the cushion. When these discs bulge, herniate, or begin to break down, as in degenerative disc disease, they apply pressure to the spinal nerve root. Here's an example. You can see here in this example that this disc is big and healthy and provides lots of space back here for the spinal nerve root. But in this situation, known as spinal stenosis, the disc has decreased in height, and now we don't have the same amount of space back here on the nerve root. So in a patient like this, movement, even getting in and out of a car, walking for long periods of time or sitting, will irritate that nerve root and cause pain either in the back or down into the leg, known as sciatica. The spinal decompression brace, the DDS 500, accomplishes two specific goals. One, the brace allows us to decompress the disc. So when we apply the brace, it physically separates the joint like this, taking all the pressure off the nerve root. The second thing that the brace allows us to do is allows the patient, while they're wearing the brace, to engage in activity, movement. Now this movement is critically important in healing the disc long term, because the disc needs blood and oxygen, or a flow of fluids into the disc to stimulate repair. So when you put the brace on and you move, you're creating a pumping mechanism, and that pumping mechanism pushes fluid in and out of the disc, which promotes repair of the cushion and long-term healing. The cushion, or the disc, is very much like a sponge. And if you imagine your sponge or your disc as being compressed like this, then the DDS 500 brace allows you to decompress the disc, taking the pressure off of it. And now, while the disc is in a decompressed state, your movement and activity creates this pumping mechanism. And the pumping mechanism draws vital fluids in and out of the cushion, allowing it to heal. So it's a remarkable device. It's comfortable. And we're going to want you to wear this brace for a minimum of 2 hours a day. But you can wear it up to 5 hours. Be careful, though, of damage to the skin. If you're wearing the brace directly against the skin, you want to make sure that you're not rubbing the skin and creating ulceration, especially if you have blood flow problems, such as in diabetes. A lot of patients will wear the brace with an undershirt between the skin and the brace. And some patients will wear it on the outside of their clothes. So it really depends on what's comfortable for you. But the target time period is 2 hours up to 5 hours a day. In the instructions, it's recommended that you do 2-hour intervals. So you wear it for a 2-hour session, take 2 hours off, and wear it for 2 hours more. However, some patients do find that wearing it in excess of 2 hours, such as a 4-hour duration in one time period, is therapeutic and does provide longer lasting results. Okay, let's have a look at the brace itself. So, when you get your brace, it'll come in a package like this. And one of the very first things you're going to want to do is you're going to want to attach the extension nozzle. So in the bag that has the instructions, you will find an extension nozzle. Here we go. If you can get it open. All right. What you're going to do is you're going to take your brace and you're going to unscrew the valve, which is like a bicycle pump. And then you're going to take your extension nozzle and you're going to screw that on like that, and make sure it's on nice and tight. One of the main problems with the brace is that this nozzle gets loose from putting it on and off, and if it gets loose, what's going to happen is it's going to leak. So always make sure that's nice and tight. Then take the other piece of your valve here and just screw it onto the top and keep that closed. There. Now you've got the extension nozzle attached, and that's going to make it a lot easier to put the brace on and off and inflate it when we get ready. just a side note, you can wash this brace in a washing machine. To do that, take your brace, remove the extension nozzle that we just put on, replacing the top cap back on here. Make sure all the ear is out and make sure that the cap is on snugly. Then you're going to put the brace in your garment bag that comes with the brace. This goes in a washing machine on a delicate cycle with a detergent, and just make sure you hang dry the brace. Do not put the brace in a drying machine. Just hang dry it. As an alternative to that, a lot of patients find that they don't wash it in the washing machine very frequently because it takes time. Instead, what they do is they remove the brace, open it up like this, lay it out, and spray it on both sides with Lysol disinfectant spray. They just mist it and then hang it on the back of a chair or somewhere to dry. And that Lysol disinfectant spray will kill the bacteria that you're going to get on the brace from sweat, and it'll really prevent the brace from deteriorating, and it'll keep it nice and clean, which is what you definitely want to do. So another important characteristic we want to look at of the brace is the mechanism of pumping. So with your brace, you're going to get this pump. It has an extension piece on it here, and it's just like a bicycle pump. But what's important here is the face of the pump. So you'll notice in the face of the pump there are some different colors: green, yellow, and red. The green represents 10 pounds per square inch of pressure, and the amber or the yellow is about 12.5, and the red is 15. So the range of pressure to get the best treatment is between 10 and 15. Obviously, if you're a smaller person, you're going to use less pressure. You're going to use more in the 10 zone. You're going to keep it in the green zone. If you're a little larger person or muscular, you're going to go up into the yellow zone. But the maximum pressure that you can use safely is 15. And 15 is the very beginning of the red zone. So what I would recommend, of course, is trying the brace on, beginning at the least amount of pressure, and only increasing pressure if you find you're not getting results. What we want to do is achieve the most results with the least amount of pressure. That's an ideal situation. Also, if you find that you're wearing the brace and you're getting constipation or stomach irritation, you may be using too much pressure. You want to reduce the pressure and also ensure that you're fitting it properly on your body. So let's look at how you apply the brace. And for that, I'm going to take my coat off and show you how to position it. Okay. So we want to make sure that all the ear is out of the brace, which we've done here. You also want to pay attention to a few landmarks. You'll notice there's a tag right here, the DDS logo tag. This tag should more or less be directly in front of your belly button when you're applying the brace. So that's a nice way to judge if you're in the right location. Another important factor is that the brace should go just at your pelvic ilium line. What that means is that if you take your hands and you put your two hands here on top of your ilium or your pelvis. For me, for example, that's at this location right here. Now I want you to notice that that is not at my belt line. My belt line is actually sitting below the pelvic line. So when we apply the brace will sit on top of the pelvis, not down lower where the hips would be. Now there's a reason for this, and that reason is that the spinal discs actually sit, the lower spinal discs, at the level of the pelvis. Even if you're getting sciatic pain, for example, which will come down into the buttock area and down the leg, this is not where the cause of the problem is. These nerves in the buttock area and down the leg, their nerve roots are actually up here above that spot. So when we apply the brace, we want to put it in the correct anatomical position so we can target the spinal discs. We are not trying to treat the sacroiliac joints or the pelvis. So we want to make sure we put it in the proper place. And here's how that looks. We take the brace like this, here, hold it like this with the valve up, bring it around, like this, here. Make sure it sits above that pelvic line, and then bringing the Velcro here across, we attach it as so, like this. This is the proper positioning of the brace. Then we take this, which is a safety catch to ensure that it doesn't come off, tighten it all the way around, and let it sit right there. Now, again, you can make minor adjustments, but more or less that's where it sits. My belly button, for example, is directly behind here, so I'm in a perfect position. A nice way to check and see if your brace is in the correct place is when you sit. When you sit, your brace should not ride up. If it rides up, then it's too low, and that's really important to understand. Again, back to the anatomy of the pelvis in relationship to where those nerves are. So we're sitting like that. Perfect. The next thing we're going to want to do is get the pump, and you'll notice that on the pump there is a shoe, a little notch right there, and it's almost like a clothespin. So how it's attached properly is as follows. We take the head of the valve and turn it upright. We take the shoe with the notch, and it slides right over onto that, like so. You'll know it's in the correct place because the hose is going to run in a straight line. From this position here, we then begin to inflate the pump, extending the pump all the way out to maximum extension and then bringing it back together like this. And as you notice, as I pump, what you'll notice is that the brace begins to expand. And we continue to pump until we get our pressure. That pressure should be somewhere between 10 and 15 psi. And in my case, I'm in at 12.5 psi. So this is a good pressure for me. Then we release the pump and take the extension nozzle, and we are going to tuck it in the outside of the tension strap, like that. Now, brace is in place, everything is secure, everything feels good, and I will keep this brace on for the next 2 hours as a minimum, okay? But in no circumstances will I ever sleep in this brace. The brace must be removed before you go to sleep. And you have a good look at that and where it's positioned. Here, a properly fitting brace should be comfortable, and it should be very form-fitting, snug like this. And it should not slide up and down as we walk or as we sit or squat. It remains in a perfect location. Now, to remove the brace, we always take the valve back out and turn it this way to release the pressure. As we do that, all the pressure is released from the brace. If, by the way, you turn this too much, you will take the top of the nozzle off. It'll come off. If that happens, you just put it back on, screw it back on. It's just like a bicycle pump. Once all the pressure is removed, take off the safety strap, remove the brace fully, just like that. And that is how you use your brace. Again, you want to ensure that you're in the proper position on your body. Do not try to lower the brace down to where, in most cases, the pain is. Keep it at the pelvic line, or at the top of what we call the ilium, or the iliac crest. That's where it needs to be. Now, there's some additional pieces that have come with your brace that I want to briefly go over. One are these panels. So in your brace package, you'll find you have two panels, a back panel and a front panel. And I want to show you how to use these. Again, all the instructions are located in your manual. So this is very simple. Once you get it out of the plastic, it goes like this. Here's your panel. You're just going to take your brace and you're going to weave it through the back of the panel like this. Voila. Okay? Just like that. And everything else applies the same as we said before. It's just that with this panel in place now, you apply your brace again in the same fashion, in the same location, correct? Everything's the same, but the difference now is that we have applied the back stabilization panel. Now this back panel, you'll notice, does slide up and down. And it's designed to do that for proper positioning. The panel is used for two purposes. One is it's a physical guard against any kind of external force or pressure against your spine. In many patients that have had back surgery, the spine itself is very tender, and applying this back panel will protect the spine. And when you're sitting down in a chair, for example, it will act as a back support, like a back support that you would buy to put in your car or something like that. So it's pretty effective, and it will protect your spine, and it will actually, over time, help mold the spine, putting the proper curvature in your back. So it's a great tool to use, and you can apply it, like I said, to the back, and use it while you're sitting, and maybe while you're driving, if it feels comfortable, you can use that. Also, if I have patients that are bent severely to one side, or in a patient where extension, bending backward, hurts a lot, the panels are ideal, because the back panel will prevent that motion. So that's how the back panel is applied. Now, there's a front panel as well that I want to show you, and this is really interesting. The front panel has two purposes. The first purpose of the front panel is it acts as a sling to support the abdomen. So in some of my patients that have a protruding abdomen, they find that when they blow up the brace, some of the body tissue will bulge on the top. And it doesn't look good, and it doesn't feel good. Well, this can be applied as a protective sling to support the entire abdomen. So here's how that works. Real simple. We just simply take the panel, and there's Velcro on it, and we just attach the Velcro to the back of the brace like this. And then the brace goes back on in the same position, just like that. So the panel, the front panel, just goes right there. It just stays right behind there. And now what that will do is it creates a larger area for the brace to decompress. Doesn't dig into the stomach. And most of my patients that tend to have a little bit of a larger abdomen, they really like this. Also, by using the front panel and the back panel together, now when we inflate the brace, we're going to be able to increase the pressure and get a much stronger decompression. So it's an ideal situation to use both panels, especially if you're going to be very active. It'll just feel more secure, and you'll really get a better treatment with these two panels in place. Does everybody use the panels? No, they don't. A lot of times patients will not use the back panel if they're going out because they don't like the way it looks. However, if you read the research, both panels in place and between 10 and 15 psi of pressure really provides the optimal treatment for decompressing the spinal discs and getting you better faster. So I really encourage you to consider both of these panels for your treatment. Again, taking it off will be the same, letting the ear out first, and then just removing it as we did before, like that. And you can see that the panels stay attached like this to the brace on their own accord. Okay, just like that. So, if you have any questions about using your brace effectively, or if you have any problems with sizing, or if you have any problems with the brace holding pressure or anything like that, please contact my office directly. There is a 12-month warranty on the brace. If you have any problems at all, we'll take care of it or we'll replace the brace free of charge. So, good luck and best of health.